Hello, everybody. I will briefly introduce myself. I'm Dr. Federico Cobelli, and I work as a consultant in the University Hospital Basel. And I normally record videos in Italian for people living in Italy about the coronavirus. And for now, but I'm trying now to record also some of them in English because I think that I can spread some more information this way around the world or maybe in other countries than Italy. And so I please you to forgive me if my Italian accent is a bit too evident, but as it's no matter whether I work in Switzerland, but I'm still an Italian masquerading as a Swiss man. So basically, I would like today to discuss a theme which has been very diffused, let's say that, in Italy in the latest days. That is the comparison between plasma therapy and vaccines. For now, about the plasma therapy, I don't know whether you exactly know what it is. So basically, plasma therapy is a therapy consisting in injecting plasma, which is a part of the blood. And this blood has, of course, to be divided into its components. And plasma is the one who contains the antibodies. And these antibodies are taken, of course, from a person who was ill and has recovered from coronavirus. And so they should be able to stop the virus in the foreign body. And I have to say there was an experimentation in Italy in the latest days. It was over on the 29th of April. And I'm still waiting, of course, for the results. But from the people working there, I received the information that this plasma therapy is really going to work. So basically, they treated, I think in Padua, for example, it was treated, 11 patients were treated, and all 11 showed a very good therapy response. So basically, it seems to work. There is just one limitation of the plasma therapy. That is to say, plasma, as I said, comes from a person who had the disease and recover from it. So basically, it's clear that if we have too many people who are still experiencing the illness and the number of potential donors is really low, then we have a problem to obtain so much plasma as possible. So, because of course we also have to keep in mind that we need 2 donors to produce enough plasma for 1 person. So, again, coming back to the example in Italy, so this hospital who experienced and tried to use this therapy said that 60 people volunteered to donate their plasma. That is to say that in the whole region they will probably be able just to treat 30 patients. And I don't know whether you know exactly the numbers of contagions in northern Italy. So there are much more than 30. So basically, it's a very good therapy. Apparently, it seems to work. But still, it works if we don't have a large amount of people needing this kind of therapy. Otherwise, we have a lot of people who is not able to receive the therapy. And how can we prevent this situation? Just by preventing the contagions. How can we do that? So up to now we don't have a vaccine. So the only possibility we have is basically to keep the social distancing and to wear facial masks and basically to wash our hands as much as possible. So basically they are hygiene procedures which seem to be very easy, but basically they're really important to prevent contagions. And as soon as we have the vaccination, then it will be perfect to let yourself vaccine. Because it's just the only way we have really to prevent the contagions. And this is also very good if you then want to apply the plasma therapy. Because, of course, if we have a very low number of people who are under illness, then we can really provide them with a very effective therapy, which is also the plasma vaccination, the plasma therapy. So basically, what I want to say is the 2 things, so vaccination and plasma therapy, are not something which are divergent, but rather they're complementary. So basically, we have to reach the goal of the so less contagions as possible, and then we have enough possibility to provide them with the right therapy. So basically, if you hear about, okay, now we have the plasma therapy, why should we look for a vaccine? This is the reason, because plasma therapy may work, but if we have too many patients to treat, then it doesn't work anymore, because it works just in a little fraction of patients. Okay, that was the first video I tried to translate in English, and I will try to provide you with other videos in the next future. If you have some question, if you have some doubts, if you think I said a completely bullshit, please, it's fine. Write it down here or in my Facebook group. Okay? So I wish you a very good Sunday and see you soon. Bye.